Messages from the Senate.
Message from the Senate. This is the Hoppe motion. Mr. Speaker, I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File Number 1, an act relating to health care. The message is signed by Cal R. Ludeman, Secretary of the Senate. The Conference Committee is addressed to the Honorable Michelle L. Fischbach, President of the Senate, the Honorable Kurt L. Doudt, Speaker of the House of Representatives. We, the undersigned conferees for Senate File Number 1, report that we've agreed upon the items in dispute and recommend as follows. And the Conference Committee is signed by all 5 conferees on behalf of the Senate and all 5 conferees on behalf of the House. Hoppe moves that the report of the Conference Committee on Senate File Number 1 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the member from Carver, Representative Hoppe, to introduce your motion.
Thank you, Mr. Speaker. Mr. Speaker, members, that is my motion. This is for Senate File Number 1. Left the floor last Thursday, whatever it was. Went to conference. We made some changes. I think we have a good bill, and I would recommend adoption of the Conference Committee report, Mr. Speaker.
There is a motion at the desk. The clerk will report the motion.
Schultz moved that the House refuse to adopt the Conference Committee report on Senate File Number 1 and that the bill be returned to the Conference Committee.
I recognize the member from St. Louis, Representative Schultz, to introduce your motion.
Thank you, Mr. Speaker. I move that the House refuse to adopt the Conference Committee report on Senate File 1 and that the bill be returned to Conference Committee. I chose to be a state legislator to serve the public and improve the lives of Minnesota, make their lives better. I wanted to come down here and work hard on health care reform, and I'm very disappointed in this bill and the politics that prevented immediate premium relief to working families to make their lives better. The biggest problem in this bill is that it allows for-profit HMOs to operate in Minnesota, and it allows current nonprofits to convert to for-profits. There is no evidence that this will stabilize the market, the insurance market, a task that we need to accomplish by March to stabilize it by 2018. United Health Group, a for-profit residing in Minnesota, has been exiting the individual health insurance markets across the country and has signaled that they will exit all markets next year. Premiums will likely increase with for-profits because they are profit seekers. There's also no language in the current bill that would do what other states have done when they have allowed nonprofits to convert to for-profits. Other states have required billions of dollars in health plan assets to be given to charitable foundations to work on improving public health. California mandated $3.2 billion of charitable assets to a foundation. In this bill, we're recovering $0 in charitable assets. We need to send this bill back to Conference Committee to delete sections 4 through 9, the sections that allow for-profit HMOs to operate in Minnesota. This will only take a few minutes. These provisions need to be heard in our committees to hear the implications of what for-profit HMOs would have on our market. Before we make this a permanent statute, we should at a minimum set up guidelines for conversions to protect charitable assets. I support premium relief, and I've worked with my Republican colleagues for the last 4 months in an attempt to a compromise. But instead of focusing on immediate relief, Republicans insisted on reforms to benefit corporations. insisting on eliminating coverage for essential health benefits like cancer care. Republicans have delayed premium relief for the last 4 months, putting the lives and finances of Minnesotans at risk. Instead, they wanted to prioritize giving benefits to corporations. Delaying premium relief for 4 months, this is not giving Minnesota families an opportunity for coverage. This is not making their lives better. This is giving HMOs an opportunity to make profits. Thank you.
The member from Carver, Representative Hoppe.
I'd like to ask for a roll call vote.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Hoppe.
Thank you, Mr. Speaker. Members, you know, this is not, there are things in this bill that I don't like. There are things in this bill that the governor doesn't like. It's a compromise. We all would have liked to get this done during a special session and get the premium relief out there, but we didn't. We tried to hurry this process along as quickly as we could, all agreeing that there needed to be some relief and some reforms. It was just a question of what reforms we could do. I think we have a nice balance here of putting some reform in. There are some things that we all agree we want to do, like reinsurance, that we're going to wait because we just thought it was too complicated to get that done this quickly. But in terms of the for-profit HMOs, we don't have anything in the bill that addresses them giving all of their assets away to Minnesota charities, because that's already current law. So if one of the insurers that sells health insurance in the state of Minnesota right now, a not-for-profit insurer, decides that they want to be for-profit, they have to get rid of, under current state law, they need to get rid of all their reserves, everything that they have. It needs to be distributed to Minnesota charities. Then they can start business as a new company selling for-profit insurance. We don't know what's going to happen in 2018. I've said that before. So we have to try to have things in the best shape that we can for whatever comes out of Washington. And we have a lot of parts of our state that right now we only have one health insurer that's offering these plans. We need to do whatever we can to have more options for people. We don't want to be here in 2018 or any other year looking at parts of our state with zero options. So I can't speak for United Health or any other for-profit insurer. And I know that there are for-profit insurers that have been looking to get out of the individual market in different states. But 2018 is going to be different. We all agree it's going to be a different world. We don't exactly know how, but I think it's entirely possible that we might have people that are starting to look at that and saying, maybe we get in 2018, and then in 2019 and 2020 and in the future, we can make this a viable market, and we can help our consumers of Minnesota, and we can offer them more choices. So, members, I would encourage no vote on this motion. Let's adopt this conference committee report and move on with our evening. Thank you.
Recognize the member from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker and members, and I am speaking in support of Representative Schultz's motion to send this back to conference committee. I am the oldest of 5 kids, and my middle brother had surgery on January 4th. He has an unusual cancer. He was in surgery for about 10 hours, and we hope his prognosis is going to be good. He had to find a special surgeon to take care of him because the cancer that he has is unusual. And the day before his procedure, the insurance company tried to cancel his surgery. If you listen to providers, nurses and doctors and others, you will hear often the story of people who say, I need to have this treatment done. I need this medication. And often the insurance companies are intervening between providers and patients, looking for a cheaper way, looking to deny care. I wish that it weren't the case, but I bet most of you have experienced it, and I know I have. I did with my mom when she was sick, and now with my brother. We have had, since 1969, I believe, health plans, HMOs. In 1973, we passed a law that said in Minnesota, our HMOs are going to be nonprofit. And that nonprofit status for our HMOs means that the return on their investment in public programs or otherwise are returned to care. They're returned in terms of innovation. They're returned in terms of investment in our communities. They're returned in terms of cost savings for the people in their networks. That's been the promise of nonprofit HMOs, and it has been the law in Minnesota for more than 40 years. And in my tenure working in health policy in Minnesota, starting with the passage of Minnesota Care, it's a fight that we've come up to many times and we've rejected. Because we know that a profit motive in healthcare, that competition that people keep talking about, is antithetical to the needs of people who are very sick. The people who are very sick are the ones who cost the most. They cost a lot of money. My brother's cancer surgery is going to be really expensive. The ongoing care of somebody with mental illness is really expensive. The care of somebody ongoing with diabetes is very expensive, and we can continue to work to drive innovations, but when we allow a profit motive and the need of shareholders and their return to come before the need of patients, we are allowing something that doesn't fit with our values in Minnesota, competition to drive down costs by denying care. We're allowing that to happen. The provision in this legislation has not gotten much of an airing. We've talked about that, we all know that. But even in the committees where we heard the legislation, our health plans didn't testify. I did not get a letter or a visit from the health plans in Minnesota. They didn't say we like this or we didn't like this. They didn't testify. We don't, as a legislature, really know what this means, except for that we can bank on the fact that when we insert a profit motive and a return to shareholders as the law of Minnesota, rather than returning those investments, those earnings back to our communities and our care providers and our hospitals, and to care, that people who are sick are going to get the short end of the stick. And that is why I think we should send this back and we should strip out this provision. It can be considered again in the rest of this session, but it should get a full airing, and we should know, representing Minnesotans, what the consequence of this is. And I don't think that we have had that debate. I know we didn't have it in the Health Policy Committee, and we didn't have it in the Ways and Means Committee. And I don't know that they talked about it very much in the Conference Committee. And so here we are, making a switch in policy, a significant change in policy, a 40-year policy changed without much debate that will put Minnesotans at risk. And I, like Representative Schultz and each of us here, right? We want a healthcare system that delivers care to people and it's affordable. I think we all agree with that. Where we disagree is what competition does. And when you have a heart attack, you're not going to go shopping for the best doctor. When you find out you have cancer, you're not going to make sure you're getting to the best doctor immediately, right? You're going to listen to your providers. And when we know insurance companies can intervene and say, you know what, we're going to deny that care because it's really expensive, Minnesotans aren't going to get the care that they need. I came here to fight for Minnesotans, not to make sure insurance companies from outside of Minnesota can make an earning on our market. And that's the choice that we're making today. I want premium relief for people. I wanted it back in October and November and December. It didn't happen. Minnesotans who are paying those high rates, they deserve this relief, but not with this in it. This is a bad choice for Minnesotans. There is no guarantee. There's no guarantee that this is going to do anything to the individual market, but we know what it's going to do to patient care. And as a nurse who listens to nurses and doctors and patients, we have ample reason to understand that this is not going to be good, especially for the sick people in Minnesota. And I ask you to please vote yes for Representative Schultz's motion to send this back to conference to strip this out and get premium relief on the way to the people of Minnesota. Thank you.
Any further discussion on the motion to refuse to adopt? The member from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker and members. I have two shared concerns that this isn't ready to be put into the law books. The premium relief is, I think it was ready a month or two ago. What we're passing is essentially what the governor had originally proposed. But it got additional thought, additional consideration of alternatives, I appreciate that kind of creativity coming in together into the development of our laws. When people bring their best ideas and we challenge each other and we look at what's the most cost-effective way to go, we get and usually end up with the best laws. But I'm wondering if Representative Hoppe would yield.
He will yield. Representative Loeffler.
Thank you, Representative Hoppe. When the bill first came up and you asked us to suspend the rules to consider it for immediate consideration, I had asked you if you'd had a chance to see any in-depth analysis of experts in insurance markets, heard a lot, got any kind of academic look at what other states had done who had implemented similar sort of transitions, so that we would know what the impacts would be on our market. And I'm wondering if you can tell us if in any of the hearings that you're aware of, there was independent, expert, objective analysis of the pros and cons of the market changes that you're presenting before us.
Representative Hoppe.
Thank you, Mr. Speaker, and thank you, Representative Loeffler, for the good question. We've heard, some of it was in committee, a lot of it was in the hallways. I've heard from a lot of people that are experts. We've never seen a situation exactly like this before with our healthcare, health insurance markets, and all I can really tell you is again, we're trying to get ready and trying to do what we can to be ready for next year. And I believe we're the only state in the country that only has not-for-profit HMOs right now. And I don't know that this is going to be something that's by itself going to save the individual healthcare market next year, but I think it's something we need to take a look at because we don't want to be sitting here a year from now with large parts of the state with no options.
Representative Loeffler.
Well, thank you, and I appreciate your being direct. I wasn't involved in those hallway discussions. I did listen to the Commerce Committee discussion because I thought I would be able to understand, and it wasn't there. We've heard from Representative Murphy that it wasn't in the Ways and Means or the Health and Human Services Reform Committee, and that's where we do our best work, is when we put out the information, not just by a hallway discussion, but on the public record, and let all the decision makers weigh the pros and cons of that. We had an individual market that was whipsawed, and some of us, many of us, went to the One Minnesota conference, and we heard from both Democratic and Republican national experts on this who had served in the Bush administration and in the Obama administration, and they together said, what happened in our individual market was unusual, and it was because one insurance company decided to try and buy the market with the lowest rates in the nation and thought they could make it up on volume, and it just didn't work. The population wasn't as healthy as they thought, and our markets are still whipsawing as those people transfer to other health plans, and other plans are trying to evaluate the risk. So even the smartest actuaries in the health insurance industry are not able to effectively predict some of what might happen. But that was in the individual market. Most Minnesotans get their insurance from their employers. And in this bill, there are changes in the market rules for small businesses. I'm not willing to step forward and put into law a change in the small business market that we have not had expert testimony and analysis on, because I don't want to be back here next year with an emergency bill trying to help all the small businesses and their employees. The for-profit health plans and the nonprofits, it's going to be, I think our for-profits are going to stay here. I think they've proven a commitment to our state and to the people they serve, and they employ tens of thousands of our residents. But the only way a for-profit company can compete with them and still generate that profit that the shareholders expect, if they're going to have a competitive price with a nonprofit, they have to deny care. They have to pay less for care. And I don't think there's any evidence that the nonprofits have found the best way to deliver care, or the for-profits to deliver care in a way that will actually reduce, improve health, and be able to do it at a cheaper dollar. In fact, many national studies from the Journal on JAMA, the medical journal, and from Consumer Reports have said that consistently it's the nonprofit health plans that do the best job and get the best health outcomes. I think we should send this back, refuse to accept the conference committee, bring back a clean premium relief, and continue to together listening to each other, not just to those in the hallways, but also to the academic experts. Shattuck at the U is watching what's happening in insurance in all 50 states. They didn't testify. I don't know if they were invited to. I think we can gain a lot more insight and do this thoughtfully like the people want. People's health is too important. Their insurance is too important. But I do want to say I appreciate you dropping some of the things that were even worse. But this is not ready for prime time, and I urge us to send it back to conference.
Any further discussion on the motion to refuse to adopt? Representative Hoppe.
Thank you, Mr. Speaker. And Representative Loeffler and Representative Schultz and Representative Murphy, thank you for the discussion on this. These are, I mean, the bill that we're voting on today is what we're voting on today, but we're going to have a lot more reform coming in the rest of this session, and there are things that we can work on. We all agree that we want what's best for the people of Minnesota. We just disagree on exactly how to get there. So I thank you for that. And with respect, members, I don't know if I was clear before, I would urge a no vote on the Schultz motion to send this back to committee, to conference committee.
Seeing no further discussion, the clerk will take the roll on the motion. The clerk will close the roll. There being 44 ayes and 83 nays, the motion does not prevail. Excuse me, the motion does not prevail and the amendment is not adopted. I'm going to read. That leaves us with the Hoppe motion to adopt the conference committee report before us. Further discussion on the Hoppe motion to adopt the conference committee report. The member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. And I did have the honor of serving as a conferee on this committee. And I appreciate the commitment that people have to doing work for the people of Minnesota. However, in this instance, while we're giving 125,000 Minnesotans a pretty big, important win, we're finally getting them some relief in their premiums that they have been begging for months, and that we've had in front of us for months. On the flip side, we're pushing through some changes, unvetted changes to our very delicate at this point healthcare system that we at the very best don't know if they're going to help, and if at the very worst might well destabilize our markets further. Our job in the legislature is to work to improve the lives of Minnesotans, and our job with this healthcare reform is to at the very least first do no harm. We're at a time right now where Minnesotans are looking to us for crucial help to rebuild a healthcare system that has been considered by many to be second to none in the nation. But this work is delicate. We need to ensure access for care for Minnesotans during some of the most vulnerable times in their lives, when they're welcoming a new baby into the world or battling cancer. We're hearing from Minnesotans now that are saying that the system is not accessible to them because of cost. And it's simply because we've got a market out of balance. That is our job here right now. Get the market back in balance. And do that through immediate relief. And do that through effective reform. But effective reform, folks, takes time and it takes thoughtfulness. And unfortunately, with this process, as we've discovered so often at the legislature, doing all the work in the conference committee leaves the public out of the process. Doing all the work in the conference committee leaves the experts out of the process. I heard from a number of people who said they were really struggling following conference committee because because of the way conference committees meet. There's negotiations, we recess, we move around, and it's hard for folks to keep up, even as they're following our listservs and following online. Our staff does a great job trying to keep people informed, but the nature of conference committee is quite fluid. The fact is that we should have been vetting these proposals in committee all along, and frankly, we still have time to do that. And I appreciate, Representative Hoppe, your commitment to saying that we're going to continue to work on reform. We have important work to do to stabilize the Minnesota individual market, and the fact is nothing in this proposal does that. That work is coming, and I'm committed to doing that work. We have important work to do to make sure that our small employers can provide coverage to their employees without being a full-time benefits manager. None of our small employers went into business to be full-time benefits managers. But we have to do this in a way that protects our small employees, protects our businesses, and doesn't overexpose them to risk. That's our job, is to be thoughtful, to make sure that we first do no harm to this system that our Minnesotans are depending on. And so today I'm going to cast my vote in favor of the conference committee report because I'm voting for immediate relief for Minnesotans for premium relief. But I'm not voting for for-profit health insurers to come into Minnesota. Our nonprofit health insurers have created a model where our health care premium dollars as Minnesotans go to health care. They don't go to exorbitant salaries for CEOs that top tens of millions of dollars, and they don't go to stockholders' shares. That's not their motive. Their motive is to serve the state of Minnesota and make us healthier. And I'm not voting for stop-loss insurance today because I don't know that this is going to make the market stronger. In fact, there are a lot of people who have come to me and said, we're really concerned that this is going to make the small group market less stable, put people's coverage at risk. And today I'm not voting to create situations where we're asking individuals in the healthcare system to take on more risk. But I am here to say I'm working with my colleagues on this side of the aisle on incredible reform proposals, and I'm going to work with my colleagues on the other side of the aisle to make sure that what we do represents the best of our state and the best of the healthcare reform that we have the potential to work on and pass together if we're thoughtful, if we're deliberate, and if we continue to put the people of Minnesota first. Thank you.
Any further discussion on the adoption of the conference committee report? Seeing no further discussion, all those in favor of the motion to adopt the conference committee report on Senate File 1 say aye. Aye. Those opposed, nay. The motion prevails, and the clerk will give the bill its third reading as amended by conference.
Third reading, Senate File number 1, as amended by conference.
Third reading as amended by conference. Any further discussion? The member from Olmsted, Representative Liebling.
Mr. Speaker, 90 days ago, the governor presented his proposal for immediate premium relief. He presented a proposal 90 days ago, and here we are. Here we are. The proposal that's before you today, the proposal that was before you 90 days ago that we could have passed in special session 90 days ago was for 1 year of help, just 1 year. 1 year of a premium discount for Minnesotans who really need the help, and they need it now. They needed it already. This time should not have gone by without them getting the help they need. The purpose of doing short-term immediate relief was to give us a chance to come into session and consider carefully what we could do to stabilize the insurance market in 2018, to give us time to think carefully about this very complicated subject so that we would do no harm, so that we could actually make things better for the Minnesotans who are counting on us so that they will have access to health care. The governor presented his proposal. It was very, very much like what we have in the bill before us today, but that wasn't good enough for the GOP. The speaker said on TV that the governor should resign if he didn't come up with something, and the governor came up with something, but nope, wasn't good enough. It just wasn't good enough for the GOP. The GOP had to hold Minnesotans hostage. And why? What do you get in this bill that was worth holding Minnesotans hostage for? You've got a bunch of risky and poorly considered policy changes that will not stabilize the market for 2018 and could very well destabilize the market. Poorly considered, risky proposals. When you could have just done the right thing. You could have just passed immediate relief, and then we could have taken time to fully consider what to do with the market. And Representative Hoppe, I know you're a person of goodwill, and I just listened to your answer to Representative Loeffler, and what you said was that you took testimony in the hallway. You heard from the experts in the hallway. Well, that's great. You know, I'm glad you understand. I don't doubt for a minute that you understand some of these proposals, but again, we all represent a district. We all have people that we need to answer to, and we all need the opportunity, and more importantly, our constituents need the opportunity to hear from the experts and understand the pros and cons of the various proposals, and we have not had that. And that is why I continue to say that these proposals, that these provisions in the bill that I know that you all are going to pass today are risky and poorly considered. But one thing I think is pretty clear, they don't help Minnesotans in 2018. Now, I hope Representative Hoppe's right that we'll come back and we'll do something that actually does. But I thought the point was that you were holding that hostage because you were really going to fix something for 2018, and you have not. So we've made Minnesotans wait. We've kept this proposal hostage for 90 days. And now we've got these other things attached to it that are actually going to take us in the wrong direction. So this is a bill that's really about short-term gain because it's only a year of premium help. That was always the proposal, 1 year. It's short-term gain, but it's possibly long-term pain. Short-term gain, long-term pain. That's what this proposal before you does. So Representative Hoppe mentioned that, you know, we've got this thing about the for-profit insurance companies. It's to have more options in the market, make sure there is an option. Well, we've got a proposal for that. Members, we've got a proposal on the table that's for a public option which would serve as a rock-solid backstop to make sure that there is an option for Minnesotans to buy. The projections are that it would be less costly than the options they have now, and that would give them access to providers all over the state, which our current options do not. So there is something there. We do not have to go to for-profit insurers who, as Representative Murphy said, would have a profit motive. They need to earn a profit off of Minnesotans' need for health care. That is not a road we need to go down. We need a proposal. We need to have real reform, and real reform cannot be rushed through. It has to be carefully considered. But I know one thing. I know that nobody really likes having to buy insurance, and nobody really likes having to deal with insurance companies. Nobody likes having to worry about whether they've satisfied their deductible, whether they're going to have a copay. Nobody likes to have to read that policy or worry that they didn't read it and that it says something that's going to be a gotcha at the end. Nobody really wants insurance. Insurance is a means to an end. Unfortunately, right now, it's kind of the only means to the end for a lot of people. What Minnesotans really want is health care. Health care when they need it, where they need it, and at a price they can afford. And there is nothing in this bill that moves us closer to that goal, nothing at all. Yes, it finally comes through. Finally, the GOP has come around to see that this is the only sensible proposal for giving discount relief, for giving premium relief to Minnesotans that's going to be able to be implemented anytime soon. Too bad we didn't do it 90 days ago, but okay, here it is. But to link it to these proposals that will not stabilize the market in 2018 and that do not move Minnesota forward, that is really a shame. I urge members to vote no on the bill.
Further discussion. The member from Dakota, Representative Hansen.
Thank you, Mr. Speaker. Would Representative Hoppe yield for a question?
He will yield. Representative Hansen.
Thank you, Mr. Speaker. Representative Hoppe, and I think you know I kind of look at definitions and try to make sure things are working right. And I'm looking on page 10 and 11, and maybe this is a Representative Miller question, but going back to the Agricultural Cooperative Health Plan. And I'm looking at who's a member. So on page 10.24 and 10.25, it references 308A and 308B as the definitions of cooperatives. And I can't find a definition of production agriculture or a reference even to agricultural cooperatives. So it looks like that we are creating a new, in this healthcare law, we're creating a new type of cooperative. And if we're creating a new type of cooperative, it talks about members who actively work in production agriculture and file a tax form 1065 or Schedule F income tax, or provide direct services. So my question is, if we're creating a new cooperative, and elsewhere in the reference statute, it says that the cooperative can determine its members, but production agriculture isn't identified or isn't defined. Can there be exclusion of membership that is not based on health? I mean, I see the protection on health criteria, but can the cooperative be established that is limited in terms of its members?
The member from Carver, Representative Hoppe.
Thank you, Mr. Speaker, and Representative Hansen. Representative Hansen, if you look on page 11 of the bill, I'm not sure where it starts. It's all about starting, how they do this. But if you look at 11.19, it says members who actively work in production agriculture in Minnesota and file the forms. From there, it kind of specifies down what some of the criteria are and how they would go about starting this.
Mr. Speaker, if Representative Hoppe would continue to yield.
Representative Hansen.
Thank you, Mr. Speaker. Representative Hoppe, so the definition of actively work in production agriculture, could that include, say, the owner and workers of a medical cannabis facility? Could it include the owner and workers for an apiary? Could it include the owner and workers of a horse farm?
He will yield. Representative Hoppe.
Thank you, Mr. Speaker, and Representative Hansen. I don't know if you're proposing we go into business together, but this could be fun. I think the answer to your question is yes, they could be part of it as long as they fulfill the rest of the legal requirements in statute and the other sections of the law that currently exist.
Representative Hansen.
And thank you, Mr. Speaker. One final question, if Representative Hoppe would yield. So I see that, and then I look on 11.30, 11.31, 11.32, and it talks about members of the cooperative. So it appears the members of the cooperative are those that are involved in production agriculture that have the appropriate tax forms to show that they're actively engaged in farming, and that the health care can be provided to them and their dependents, the employees of that cooperative and their dependents, and the employees of the cooperative that establishes the plan and their dependents. So the way this is being, I would assume this is being interpreted, would be inclusive, that all employees could be covered rather than exclusive, where a narrowly defined cooperative could exclude employees.
He will yield. Representative Hoppe.
Thank you, Mr. Speaker and Representative Hansen. I think the answer to your question is yes. Nobody should be excluded by this, and the intent is to give people another option to have a better way to get less expensive health insurance coverage. So no, the intent is not to exclude anybody, and they would still have to follow all the tenets of the Affordable Care Act.
Representative Hansen. Further discussion on Senate File 1 repassage. The member from Roseau, Representative Fabian.
Thank you, Mr. Speaker, and, and members. I wasn't going to say a whole lot about the bill. Quite frankly, I'm pretty proud of the people of Northwest Minnesota who came here to the Capitol to testify on the provision in the bill that we worked on. And when we worked on it, we worked with local providers, clinics and hospitals in my district. I worked with the Department of Health, and I worked with the insurance providers to put some language in the bill that is going to address the concern that is one of, if not the single largest concern with regards to what's going on in the healthcare in my area, and I know around many parts of the state. We had a hearing in Chair Dean's committee on network adequacy and the waivers that were granted to the insurance companies that excluded many hospitals and clinics all around the state of Minnesota. And then the notion that somehow the process has left people out, it's just the opposite. People have been included in this process. You know, we heard the comments made about Chair Hoppe cutting deals in the hallway or whatever. And we've heard some comments referencing lobbyists and so forth. The best lobbyist that the people in Northwest Minnesota have is standing right here on the House floor. And I work a lot with those folks up there. And I've heard that the passing of this bill, and by going just with the premium relief, and we should do no harm, members, the fact of the matter is that the harm has already been caused, and we need to fix it. I've heard the terms used that we are holding Minnesotans hostage. And what's it worth? Members, the people in my district are the ones who've been held hostage by the decisions that were made in the past. When you have to drive 100 miles for primary care, that's not adequate. And by granting of the adequacy, by granting of the waivers on adequacy, that's not right. And so what we did here was we put together a proposal, a plan that's in the bill that gives the hospitals and the clinics in Minnesota an opportunity to appeal the decision of the Department of Health Commissioner to grant the waiver. And it's spelled out there. I'm not going to go through all of the details on it. But it does allow them to file an appeal with the administrative law judge at the Office of Administrative Hearings. And when they are notified that they are out of network, that they are not a part of the plan, they have 60 days from that date to proceed. The commissioner worked with the insurance companies. They wanted, I'll say, a place at the table in this process. And we worked with them to get some language that allows them to be provided notice that the appeal is going to be granted. The decision of the administrative law judge is a final decision regarding the waiver, and the losing party pays. So if the Department of Health has made a bad decision from the perspective of the administrative law judge, the Department of Health will pay the costs. If the Department of Health has made a good decision from the perspective of the administrative law judge, the party bringing the case forward pays the bills. And to say that there's nothing in this bill that helps people immediately this year, folks, this can help because it's effective now. As soon as this bill is signed by Governor Dayton, this takes effect, and it's retroactive to January 1 of 2017. This division, or this subdivision in the bill expires December 31st, 2018, so there is a sunset on it. I've heard that there's a bunch of risky and poorly considered proposals in this bill. False. I've heard that this is going the wrong direction. I'll tell you what the wrong direction is. It's when you have to travel 100 miles and turn left at Greenbush and go to Thief River Falls for care. Great facility in Thief River Falls. But how many pregnant women want to drive 100 miles to have their babies delivered? I heard also on the floor that what Minnesotans want in health care is to have it when and where they need it. We need it in our home communities. We need it at the clinic in Warroad. We need it at the clinic in Roseau. And we need it at the clinic in Greenbush. And we need it in the hospital in Roseau. Members, this is an outstanding bill. This is a provision that's not going to guarantee anything, but at least it gives those parties an avenue with which to file an appeal. And to Chair Hoppe and the rest of the conferees, I appreciate the work. The staff is unbelievable, partisan and nonpartisan staff. These people put in long, long hours. They put together a great bill. I'm glad that we were able to get the things into the bill that actually matter to Minnesotans. I'll be voting green, and I encourage everyone to do the same. Thank you, Mr. Speaker.
The member from Candy, Ojai, Representative Miller.
Thank you, Mr. Speaker. Members, today is a good day. With this bill, we're going to be able to improve health care in Minnesota, something that we've been trying to do for the last several years. With the Ag Cooperative Health Plan, people in Minnesota, rural Minnesota they'll have choice, they're going to have access, and they're going to have affordable health care. In the Ag Cooperative Health Plan, we are going to enable farmers, those in agribusiness, to group together in a very organized, very stable way, in a way that's going to help these people to add choice to what they want from health care. It is going to enable them to work with their local clinics. I spoke with the CEO in the Renville County Hospitals just this last week, and I talked to him about the possibility of this moving forward. He was very excited about this because one of the things that's been happening over the last several months is they have been losing network capacity for many of the people in their own community. Now, this not only affects the people that have to come and be treated there, but of course it affects these clinics. It affects the doctors. Everyone here understands how difficult it is to get doctors into rural Minnesota. It's even more difficult when they have no patients that they can see. This agricultural cooperative health plan is going to enable people to set up networks within their communities. Cooperatives are a beautiful model. In the state of Minnesota, we do cooperatives very well. We lead the nation with cooperatives. We know how to do them. We know how they work. This is going to happen now. Cooperatives are so good because what benefits me benefits the group, and what benefits the group benefits me. These communities in rural Minnesota are very tight. They know each other. They know their doctors. Their doctors know their patients. Many of the farmers are on the boards of these local clinics, these hospitals and clinics. And we have an opportunity now to be able to do something good for them. Today's a good day. If Governor Dayton signs this into law after we pass it off the floor here today, and I am certainly encouraged and hope that he does, I'm going to be making a phone call tonight. I'm going to be calling Rhonda. I talked about her a few weeks ago. I'm going to be able to call Rhonda. Her husband can't talk on the phone because he's the one that has throat cancer, had a big section of his tongue removed, his throat muscles removed, had to have it replaced with stomach muscles. I'm going to be able to call Rhonda tonight and have her tell her husband, Mike, that when this becomes law, with continuance of care, he is going to be able to get the chemotherapy that he needs again. He's going to be able to see the specialist that he needs. Today is a very, very good day for them. And with the Ag Health Care Plan, the Cooperative Health Plan, they're not only, and the other incredible, I thank you so much, Chair Hoppe, for the work that you've done. These other reforms are going to put them in a great position to continue this care beyond that continuance of care. This is a good day for them. This is a good day for Minnesota. Members, I encourage you to vote green on this. And then when you get home, after the governor signs this bill into law, I encourage you all to call your Mike and Rhondas that are in your district, because I know each and every one of you have them. I have received emails, phone calls, in-home visits from numerous people that are saying, please help us with this. This is a problem. Each and every one in this room is affected by this. All of you have gotten communications. When this is signed into law, I encourage each of you to contact the people in your district and say, we listened to your cries and we were able to help. Thank you, Mr. Speaker.
The member from Hennepin, Representative Hortman.
Thank you, Mr. Speaker. Members, Minnesotans on the individual market have had to wait too long for this bill. They've needed relief, and instead they've seen politics. Republicans inserted politics in a place where we should have just been coming together across party lines to get something done for people. We could have had a premium relief deal months ago. October 27th is when the governor came out with his proposal. But instead, Republicans had to ask, what can we get? And what they got was for-profit insurance and other bad ideological proposals. We have a lot of work to do to stabilize the individual market in Minnesota, and I hope we will get to that work now that we've finally taken care of premium relief for families. During the debate on House File 1, Representative Drazkowski illustrated why we needed health care reform in the first place and offered an amendment that would bring back the bad old days when insurance companies made money by denying coverage and care to Minnesota families. We've waited too long to offer this premium relief to Minnesotans, and unfortunately, it's not us who will pay the price for that, it's Minnesota families. Some of them, their insurers required that they make a decision by December 31st, and some of them, no doubt, said they couldn't afford the coverage because they couldn't count on us to provide relief. What happens when those families experience a healthcare emergency in January, February, or March of this year? What happens when somebody gets a cancer diagnosis they weren't expecting and they don't have insurance? They've decided to pay the penalty because we took 90 days to do what we could have done even before the election. Members, that's on the Republican House Speaker that couldn't take the deal that was sitting in front of him for 3 months. I'm glad we're finally providing premium relief for Minnesota families. They deserved it a long time ago.
The member from Hennepin, Representative Pepin.
Thank you, Mr. Speaker and members. It's been an interesting discussion tonight. I just wanted to clear up a few points that had been made earlier that distressed me a little bit. We are so happy that we can be here and help and bring relief to Minnesotans and to bring reform to health care. But I can't go without saying that I've heard many people speak tonight about things being rushed through or feeling like things haven't been vetted. Well, that's exactly what our side felt when this happened just a couple years ago, a few short years ago. We had over 100 amendments on our side of the aisle. We had many people on our side talk about, with experience in the industry, with experience with insurance and healthcare, talking about the reasons why this very thing was going to happen. This wasn't a surprise to our side that this happened. It really wasn't. If you listen back to some of the speeches, we spoke for many hours, and it was because we thought this would happen, this very thing would happen, and many experts, in fact, thought this would happen. And that's why not one person on our side of the aisle voted for MNsure in the first place. And now we've seen healthcare costs rising year after year, 67%, I think, on average this year. And It's frustrating that this has happened to our constituents, and our constituents expect us to fix it, and that's why we're happy to be here and help fix the problem. And I'm so grateful for Chairs Hoppy and Fabian and Dean and Davids, who worked so hard on the conference committee to get these reforms done. But I have to say, I take great offense when you talk about our side holding Minnesota hostage, and for our side waiting 90 days before we brought premium relief to Minnesota. That is simply not true. I might remind you that I believe it was 3 weeks ago today, which would have been something like 21 days ago, we wanted to declare an urgency. We urged you to declare an urgency so that we could address this very problem. And you said no, because it takes a majority. It takes more than a majority, it takes a supermajority for us to be able to do that. And you said no. So we have been trying very, very hard to do this. And I know that you just wanted to bring the relief with no reform, but it is our job as fiduciaries of the state of Minnesota, as leaders of the state, and as lawmakers to make sure that we don't just throw money at the problem, that we actually try to begin to fix the problem that brought us here in the first place. Minnesotans aren't just expecting us to give this premium relief and then throw a parade for us in downtown Minneapolis. They're expecting us to try to fix the problem. And you know what? The staff and the members who worked on this, they spent dozens and dozens and dozens of hours, weeks and weeks and weeks, months, trying to begin to create a system that'll work for Minnesota. And this bill has some really good reforms. And we need to do more work during session. But it is not our fault that you did not want to declare an urgency 3 weeks ago. And it is not our fault that you did not want to reform healthcare in Minnesota. So I'm very excited to be here. I think this is a milestone day for Minnesota. Our conferees did a great job on this bill. And it is not only going to provide relief that Minnesotans expect us to provide, but it is also going to it's also the beginning to reforming healthcare in Minnesota. And for that, it's a victory not just for the legislature, but it's also a victory for the state of Minnesota. And I also have to thank the governor for engaging in the process and for being wise enough to come to a compromise with us so that we can bring both the relief and start with the reform. So members, today I would encourage you to vote green.
The member from Carver, Representative Hoppy.
Thank you, Mr. Speaker and members. When our constituents send us here, they send us here, and oftentimes what I hear, and I think we all hear, is get something done. Now, a lot of us have talked about, and I think all of us would agree, it would have been nice to get premium relief done in a special session. We didn't get it done. Things aren't always easy to get done here. We have different people, we have different points of view. At the end of the day, we all want what's best for our people in our state, but we have different ideas on how to get there. Well, we started this session, and I mean, I'll back up. We started working on this before the election with folks on both sides of the aisle, from the Senate, from the House, with a lot of our staff. We didn't know what would happen in the election. We knew we had a problem. Once, after the election, we continued to work on it. We didn't quite get done. We started working on it this session, and Representative Liebling, I used a poor word when I said hallway. What I meant by that is a lot of the experts, the people that I talked to on the phone and email and constituents, you're right, they weren't in that conference committee room. And when I said hallway, I talked to actually very few in the hallway. But I talked to a lot of people about this. I think we've all heard from our constituent and from a lot of people about all of these issues and how important it is for people. We did have a lot of people, a lot of lobbyists have been working on this for a long time. People from the providers, people from the health insurance industry, from all over the place. You know, I said this in the conference committee. I think that a lot of them aren't very fond of me. This is not anybody's idea of a perfect bill, in that nobody got exactly what they wanted. Well, maybe it is a perfect bill, because I think there are things in there that folks on your side of the aisle don't like. I know there are things in there that the governor doesn't like. There are things in there that I'm not wild about. It's a compromise. It's the best job that we could do. I think we can go back and tell our constituents, we went and got something done, we worked together. When we started this, you know, it wasn't always easy. There were a lot of late nights, there were a lot of tense meetings, and we didn't always know what the clear path was going to be to get this done. A week ago on Wednesday, the speaker invited me to go to breakfast at the governor's residence. So it was the governor and the lieutenant governor and the speaker and the majority leader and Senator Benson and myself and Dr. Jensen, and we sat down and we talked about it. And we talked about the need for health care. We talked primarily about the need for reform, for long-term reform, for talking, and Representative Liebelein, I want to thank you for mentioning the difference between health care and health insurance. As a society, we need to change how we use health insurance. We don't use it like insurance by and large. We use it as a means for paying for health care, not just in the individual market, for all of us. So it's a distinction that we will all be wise to remember as we go on for the rest of this session. We do try to make more reforms. But essentially at that breakfast with the governor and the speaker and the majority leader, we didn't come to a complete agreement, but we were pretty close. And I think that we're going to be able to have the people of Minnesota. I'm sure there will be a press conference sometime in the next couple of days with the speaker and the governor and the majority leader and the leadership from both chambers and both parties talking about how we got something done for the people. This isn't a panacea. I've said it before. There aren't any reforms in here that by themselves are going to fix our healthcare market for 2017 or 2018. But we don't know what's coming out of Washington, and we have to be ready for it. We do know it's going to be different. We don't know exactly what it's going to be, but we know it's going to be different. I hope that these reforms are the kind of things that allow us to be ready for what comes out of Washington and take advantage of it and do the best that we can to make our state not only the great health care that we have, but the great health insurance, have broader, wider networks, have health insurance be more affordable, and do a better job for everybody from Representative Fabian's district all the way down to Southeast to Representative David's and other districts. With that, I would be remiss if I didn't thank some people. And first of all, I want to thank the governor. This has been a lot of work for the governor. And for his staff, working with Commissioner Franz and his chief of staff, Jamie Tincher, and a lot of people in his staff. A lot of effort and a lot of time went into this, and it wouldn't have worked if the speaker and the governor and the majority leader wouldn't have been able to sit down and come to an agreement to say, you guys go work it out. So thank you, Governor Dayton and Commissioner Franz. I want to thank the speaker, Representative Hortman, and you guys, I hope I'm not giving away secrets, but there have been a lot of members of the DFL that have come to me quietly and said, you know, this is hard and we know it's not a perfect solution, but I have some ideas. And we are going to keep working on reform, and we'll take the ideas from everywhere. This is something we want to get right. There are things like a reinsurance pool that I think we all agree that we need to do, but now we have the time to use the rest of the session and get that right for 2018 and beyond. You know, it sort of is strange to stand here on the House floor and say nice things about senators, but I'm going to. Working with Majority Leader Gazelka was great. He was committed to getting something done. And when you have all the leaders that are there and they tell you, hey, we really need to get this done, and there's a willingness for on all of their parts to compromise, that's great. It makes this job a lot easier. Senator Benson was a really nice person to get to work with. She did some things differently than I did. I certainly do things differently than many people, but at the end of the day, it was nice working with her. I very much enjoyed it, and all of the senators, it was, you know, it's kind of a learning process for them to a certain extent because they're just starting out in the majority, and this happened fast, as we all know. We're still in January, and we're doing conference committees, and it was a bit of a learning curve for all of us. I want to thank all of our conferees, Representative Davids, Representative Dean, Representative Fabian, and Representative Halverson. This was a conference committee where everybody that was on there had a role, and everybody was integral in getting this done. And it was, I couldn't have asked for better conferees. It really worked out well. I want to, I'll just say this. We all know this, but we should be so thankful for the nonpartisan staff we have. The people that work for the House, the fiscal staff, and our researchers, just phenomenal. Working over the weekend, last weekend, and all the late nights and all the long hours and all the things that I say that then they come back to me later and get them straightened out. Can't say enough good things about them. We are so fortunate to have them to help all of us and to help the people of the state of Minnesota. And I'm sure I'm going to miss somebody. You should never do this if you're going to miss a name, but I'm just going to, really almost every single person in House Research had a hand or a fingerprint on this bill at one point or another. But Randy Chun and Larry Pampu and Elizabeth Clark-Vist they're the three that really had to take the brunt of having to work with me the most. Sandy Glass-Tierney getting the conference committee report, Bill Marks, Nina Manzi, Joel Michael, and Pat McCormick, who sort of oversaw everything. We couldn't have done this without them. Tremendously helpful to everybody involved. And then lastly, our partisan staff. Folks, we got really good staff here all the way around. Cassandra Moore, the DFL researcher in this area. John Reynolds and Holly Iverson, the two CAs that were most involved. You know, anything that I said that was right and made sense and in the right order probably came from them. Any mistakes that I made are mistakes that I made that they just didn't correct yet. And Chelsea and Brian. Chelsea Whitman and Brian Cook. These people put in a ton of their own time, evenings and weekends, long hours, and all of this while struggling along with their regular committee assignments as well. So this was over and above what they normally do, and I think they're going to be happy to not have to put up with me at least as much for a while. We're going to keep working on reform. I would characterize this bill as a good start. I'll use the word compromise one more time. I think the governor is going to sign this bill. I think we did something good for the people of Minnesota. I think we can all go home this weekend and say, you guys sent us down here to get something done and play well together. I think we did that. Members, I appreciate your time and all of your help from everybody on this. And with that, Mr. Speaker, I would ask members for a green vote.
Seeing no further discussion, the clerk will take the roll on the bill. Clerk will close the roll. There being 108 ayes and 19 nays, the bill is repassed as amended by conference and its title agreed to.